Okay.
Okay.
Dr. Beda, tell us about bleaching.
Yes, tell me.
There's all kinds of there is the electrical laser Zoom thing. There is, of course, the doctor, doing it in the office. And then there is the $6 or $16, whatever, strips and things you can buy at the Walmart. Do each one of them have their particular function? Are they useful? Could one start with the inexpensive one? If it works, great. If not, move your way up. What's the deal there?
Absolutely. One of the most important questions we ask the patients in our office is, how do you feel about the appearance of your teeth? Not how do I feel about the appearance of your teeth. How do you feel? I want my patients' teeth to look the way that they want to. And some people, quite frankly, Helmut, have yellowish teeth, and they're perfectly satisfied with it. And that's fine with me. And some people have teeth that are, white as a sheet of paper, and they want them whiter. We call them Eric Estrada. We call him Eric Estrada White because he had all of those fake crowns, the guy that was on Chips from years ago, and you could just tell him from like a mile away. So,
it's like with the girls. There's some girls out there they couldn't be any more gorgeous, and they're running around thinking they're ugly and need to lose weight.
Absolutely, precisely. So anyhow, to get back to the gist of your question, you were saying, can somebody start out? You can start out by using some of the over-counter items. If they work for you, fantastic. Absolutely fantastic. I've seen some people use some of the white strips and things and have gotten decent results. I've seen some people waste a ton of money on the white strips. I've seen some people go in and they want
what do you mean by waste a ton of money? They only cost a little bit. I mean, couldn't waste a ton of it.
If they're trying them 3 or 4 times, those strips are it adds up. It adds up after a while.
I guess so.
Where maybe they're paying, close to $100 after they've done all of the strips and that sort of thing. And to do that with no results, to me, is kind of like throwing money away. But that's up to the patient. And then I've seen other patients who want to do in-office bleaching and whitening that, because they need it right away. I have found and this is one doctor's opinion on this, and it's supported by a lot of other doctors, and of course you're going to get other opinions in here too. The way that I like to do bleaching in the office is for us to make thin custom trays after the patient has completed any type of back teeth treatment, so we don't have to change out the trays. And we take impressions, we make some thin, flexible trays, and then from the office they pick up a prescription bleaching gel that the patients themselves can control. So within a 2-week period of time, we know that that's going to work and lighten up their teeth. If they want them lighter than that, if they want them Eric Estrada White, they can lighten them to that. If they want to keep them where they're at before the 2 weeks and save some of the gel, they can do that. I've just found that to be an effective and fairly inexpensive way so that the patient isn't laying out tons of money for some in-office stuff that may take their teeth 14 shades lighter, and it may not. So that's how I do it in the office. The trays are comfortable. They can wear them where they want to, when they want to. They only have to wear them a little over an hour a day, and pretty much everybody can find time within the next 2 weeks to pop them in for about an hour a day. It works great. It's effective. Do I have anything personally against people trying other things to do, or if they want them power whitened, in the office because they only got 1 hour to do it with? Absolutely fine. There's a variety of different ways to do it, pros and cons to all of the variety of ways. I've just found out what works for me, and it's like anything else in life. You find something that works, and if it's simple and it's being effective, then just kind of stick to it. I think it works pretty well.
Well, good. Looks like you explained it. So basically, all methods, none of them is really hurting him. They might work. He might have wasted a little bit of money. And so your approach is kind of start somewhere in the middle. That kind of has a pretty hell of a proven result, is relatively convenient, and here we go.